Hi, welcome to this podcast. Today we'll be discussing syphilis. We're going to specifically discuss the symptoms, where you can get tested, what treatments are available, and then we'll discuss a story about a young man who experienced this himself. First, what are the symptoms of syphilis? Syphilis happens in a few stages, but the first stage is going to be a sore around the genital region, sometimes around the mouth or rectum. This sore is completely painless, which makes it easy to ignore. After that, the sore will go away. And then the other symptoms that will begin in the next stage are things like fever, sore throat, weight loss, headaches, symptoms that are actually pretty easy to ignore as they can be an indication of other illnesses. But the one symptom that is an indication that you might be infected with syphilis is going to be a rash on the hands and feet. That's not something you see with a lot of other illnesses, and it does follow having a sore around the genital region. So suppose this happens, where can you get tested? It's a really good question because not everyone has insurance, and if you do have insurance, not all health insurances cover STD or STI testing. But the Minnesota Health Department, as well as Planned Parenthood, do provide free STD, STI testing for individuals who need that service, who maybe their insurance doesn't cover it. Now, once you go and get tested, is syphilis a treatable disease? It is today. It's a bacterial infection, which means an antibiotic is necessary to treat it. Syphilis specifically is treated with 2 injections of an antibiotic 1 week apart. You'll get 1 injection, wait 7 days, and get the second injection. After that second injection, you will need to wait 7 days before having sex again to make sure that all of the bacterial infection is out of your body. Now we're going to talk about Jordan. Jordan was a young man. He was a freshman in college. He had recently come out as gay and was experiencing new social circles and learning to be comfortable with himself and his newfound self. As he began his freshman year, he began dating another young man. It was his first boyfriend, and he was experiencing all kinds of new experiences, including having sex. A few months into the relationship, however, Jordan did begin to notice a painless sore in his genital region. Now, it was painless, didn't bother him. It was easy to ignore. He couldn't remember hurting himself or falling or injuring himself, but since it didn't cause any pain, he figured it'll just go away on its own. After a few months, he did break up with his first boyfriend, and being very devastated and being very overwhelmed with finals and school and everything else going on in his life, as other symptoms like headaches and hair loss and weight loss began, it was easy to ignore those and attribute those symptoms to just everyday chaotic and stressful life. However, as he developed a rash on his hands and feet, that was harder to explain, and he couldn't really say, well, rashes develop like this when you're stressed out, because it wasn't any kind of allergic reaction. So he decided to go to the doctor. But how could he go to the doctor when he didn't have health insurance? Being a college student paying tuition, this was going to be an expense he wasn't prepared for. So he learned he could go to the Minnesota Health Department to receive an STD/STI panel, a test. And this is what he decided to do. After he went in, he received a call from a nurse a few days later who informed him that he had tested positive and would need to return to the health department to receive 2 injections, 1 week apart each, to clear up the infection. He proceeded to do this, and after he had received all the injections, he felt significantly better. And he discussed with the nurse ways to prevent future infection, at which point she explained to him the single easiest way to prevent future infection of any STD is to use a condom with all future sexual partners. And this helped to empower him to feel like he could be in control of his own sexual life and prevent further infections and dangerous to his own health. Now, if you're curious to learn more about syphilis, where you can get tested, and what those symptoms are and treatments that are available in your own area, please visit the Minnesota Health Department, where you can learn more and make an appointment for yourself if you need to. Thank you.